Coach Andy Fortuna here, and we're going to be talking about the release using the lacrosse ball for the pec and chest area, right? So I like to use the lacrosse ball just because the setup that I like to use here to allow for us more room and a little more comfortable is more beneficial with the lacrosse ball. So I'm going to use the rack here, but this rack could also be a wall, a door frame, whatever it is you like to use. I like to use a yoga block so that it gives me a little bit more space from that surface so that I can use a little more range of motion, right? So using the lacrosse ball, I'm going to scan where those tension areas are, right? Usually closer to the insertion, right, or closer to the sternum, you're going to have some tightness there, and then closer into the shoulder. Like we talked about in the previous video, we want to make sure we're not going into any sharp, painful areas or any nervy areas. There might be points where it's like an in-between, where you're not having any like nerving sensations or super sharp pain, but you're in that sweet spot of, you know, this spot needs to work, and it's not too much for you where you can breathe and still be in a good position. So again, you want to avoid any bony parts. You want to avoid any super sharp pain, and go from there. All right. So again, I'm gonna place the yoga block right on top of the rack. And again, you can do this on a wall or on the door frame as well. I'm just gonna do the rack just because we have this available. I'm gonna put the lacrosse ball there, and right where I have scanned, right, and I can do the scanning again and find that point where it needs a little more tension. And I'm gonna lean, right? I can step my feet away a little bit so I have a little more pressure, body pressure, right? And bring that foot forward so I can create a little more stability. And then from there, I'm gonna work, right? Find that spot, boom, right there. I'm gonna take big, deep breaths, inhale and exhale. Just your breathing alone is gonna create a mobilization in the soft tissue, right? Because your rib cage is expanding. As you inhale and you expand, you're applying over pressure into the ball. And as you exhale, allows the ball to go a little deeper into different tissues, and you work through those, right? So from there, you know, once I have, you know, a minute or so there, and I find I'm in a good position, I can go into range of motion, up and down, right? You can go a little bit more, you can go into really whatever movements you want to work on. You can go forward, flexion, extension, right? So because we have the rack here, I can go and explore these ranges here and back, bring the arm behind me. If I'm at a wall, right? If I'm here at a wall, then I can kind of slide up. I bring it down, slide to the side, bring it away. So you can get creative as long as, again, you can breathe through it, as long as you're not guarding, and work your way through there, okay? So that's that release.